Hello viewers, welcome back to the YouTube channel of Yash IVF. This is Sainath Pradhan, CEO, and today we are going to be discussing a very important aspect, and that is the cost of an IVF cycle. At Yash IVF, however, we are going to focus on reducing the cost to achieving a live birth. There is a difference. I hope you have noted this. It's very simple. If I carry out a high quality IVF cycle, I will require a lesser number of cycles to achieve a live birth. Therefore, even if my IVF cycle might be a little on the higher side, I am quite confident that I will achieve a pregnancy or a live birth in a lesser number of cycles, and therefore your cost to a live pregnancy will be reduced. Now, how is this going to be achieved? This can be done by using some additional processes to supplement the basic IVF cycle. In this video, we will be discussing what these additional processes could be, which will raise the success rate of an IVF cycle or a test tube baby cycle from around 30 to 40% to as high as 70% and above. Let's see what we have to discuss. So there are different processes that we use during an IVF cycle. Each process has a different success rate and a different cost associated with it. A basic IVF cycle, which is a test tube baby cycle, would cost you somewhere in the range of about 70,000. But it has a certain success rate associated with it, approximately 30 to 40% internationally. There are certain processes that we can add on to this to increase the success rate of the cycle. Processes like ICSI, processes like blastocyst freezing, processes like frozen transfers. These can increase the success rate of the IVF cycle, but also increase the cost of the IVF cycle. So, what we do, we recommend to our patients, after thoroughly counseling them, the kind of process that they should follow for their cycle, and that depends entirely upon their history, the ailment that they are suffering from, what we have found in the analysis of their blood reports and their ultrasound reports, their semen analysis. Once we know what the problem is, we follow certain SOPs, which are internationally established SOPs, to achieve at a live birth. By using these different processes, we can practically double the success rate of a single IVF cycle. However, having said that, yes, the cost of the IVF cycle will also probably get doubled. So, a patient can end up with an IVF cycle in which we could be doing an ICSI, follow that up with growing the embryo for 5 days in the IVF lab. We then freeze the embryos under nitrogen, and then we will transfer the embryos, or the frozen embryo transfer as it is called, in that cycle in which the endometrial lining of the uterus is in the best condition or in the desired condition for success. In this way, we can reduce the time to pregnancy or the time to a live birth, and we can ensure that the cost to achieving a live birth is minimized, though perhaps the cost of the IVF cycle might be on the high side. So, typically, the cost of an IVF cycle could vary anything from between 1 lakh to 1.5 lakhs. It must also be noted that at Yash IVF, we do not believe in packaging of the medicines. Every patient requires a separate set of medication, that is the stimulation drugs. And therefore, we ensure that we optimize the drugs that are used for this patient. Not only does this help in the success rate, but it also increases the comfort level of the patient. So I hope you have understood what we mean by cost of the IVF cycle versus cost of achieving a live birth. Thank you.